spinoplasty with navigation. You can see where your balloon is going in the clinic without general anesthesia, under local anesthesia, and the headache part can be solved. This is already, I think, 7, 8 years, 6, 7, 8 years back. So you see where you are heading. You are already into the frontal recess. So this is where we have already reached, right? You pull it out, lower part you inflate again. So the whole frontal recess is now dilated. And the sinus headaches, the whole frontal recess area is completely dilated. Obviously, it has selected use. It's not for every patient. Then you can do the same thing for sphenoid sinus as well. This is where we have already reached, right? You are inside the sphenoid, then you dilate. Just fast forwarding, and you open up the sphenoid pretty nicely and widely. Now, one thing, septoplasty, bread and butter surgery. I do a lot of revision septums. Now see what has been done in this case. The lower part of the septum is, there's a hole, there's a septal defect, and the upper part of the septum is left, thinking that we are very near to the brain. Obviously, this thick part of the nasal septum is always below the frontal sinus. So if this teaching is available, I am just waiting for this video to play. See, this thick part of the septal bone is always below the frontal sinus. It is not below the cribriform plate. So this small understanding can help you to do a complete septoplasty, the higher part of the septal deviation. Now this thin part only is below the skull base. This is still below the frontal sinus, and only if you go behind, you'll get the skull base. So these small things, when they come to teaching, and now the newer system. So around 1.5 years back, I exchanged my older system to the new system, because the new system is a very compact one. It is the stealth system, but now the same software has come into this compact machine. And first of all, the registration has become much easier. So it has got a touch registration. If you only touch it at 2 or 3 places instead of the whole thing, you can register it. Only touch at 2 or 3 places and your registration is over. And it's much more accurate. Obviously, softwares will keep on improving in their accuracy and finesse and everything. And you can annotate points. Now, this is again a degree of artificial intelligence. You can put points, what you are interested in during that surgery. You can annotate it before, and then you can follow that path during the surgery. All right, so you first, you put the markers wherever you want to put the markers. Say frontal sinus drainage pathway, you put those markers, the colors, you make out the pathway, and during surgery, the software will take you through that path. Obviously, I do not require it most of the times, but this is what is possible. Similarly, again, as for anterior ethmoidal artery or posterior ethmoidal artery or sphenoid ostium, so then you touch the points on the anatomy, touch the points on the model. Now you can make 3D models. So if you are interested in anterior ethmoidal artery, this thing is much more useful in the tumors of the skull base and the brain. You can make 3D models, and you can see each and every blood vessel where it is actually there. Right? You can see all the vessels. I'll not go into the detail of it because it will consume a lot of time. You can do a virtual endoscopy. A lot of things you can, at least in the diagnostic part, you can, do a complete virtual endoscopy by annotating those points and just navigating through the software. During surgery also you can do this, but this is only navigating through the software. So you're actually seeing what is coming. A lot of things are, obviously, you can see the resolution of this is not great today, but maybe 5 years, 10 years down the line, it will be so great. Another thing which is helping us is in-clinic CT scan. Now, this high volume of data is produced through cone beam CT. You don't require those huge CT scans and MRI scanners. Obviously, MRI is still huge, but you can get cone beam CT is very, very good for ENT. I have installed it in both my clinics. It's such a great tool, 1/10 of the radiation. So everything is improving, and the data is very, very accurate. It is more accurate. You for the HRCT temporal bone, it is actually better than the CT scan that we do in the bigger machines. Even for the CTPNS, and you can have a full field of view now. So in one scan, you can do your E and T all in one go. I know the shape of the tongue. I know the length of the soft palate. I know the pneumatization of the mastoid. Everything in one go. You rotate it once and you have everything in the clinic. Patient enters your clinic 5 minutes down the line. Everything is scanned and in front of you. So this is what is again intelligence. Our diagnosis is improved by leaps and bounds because now I don't have to give some medicine on assumption, acha, you try this, if it doesn't work, then you come back, then I'll advise you to scan. Okay, if there's a problem, scan it. So now there's a granulation on the tympanic membrane. I have to decide whether the problem is because of his itching habits or whether there's a problem in the middle ear. I do a scan. If the middle ear is absolutely clear, now the drum is not retracted, it's only granulation. I tell him, boss, you have to remove your bud. It's your bud which is the problem, nothing else. I don't have to think about middle ear. If there's a perforation and the scan is absolutely clear, sinuses are clear, bone is straight, eustachian tube is well, everything is all right, then I know my tympanoplasty results are going to be almost, sure. So obviously, this is again intelligence. So in diagnostic decision making, AI has already come little ahead. It will go much more far. And believe me, like doctor just said, that doctors will never go out. But doctors who do not understand AI may actually replace the generation which does not understand AI. It is going to be there. We have to understand, and therefore it's mainly for the the youngsters, that you have to understand that this is your tool to have. You must understand AI, how it will help medicine. Now coming to the real AI in rhinology. So I went through the number of articles on artificial intelligence, the real AI in diagnostic. It's not there in therapeutic. It's helping in diagnostic and helping in therapy, but so far not in real therapeutics, but in diagnostic. Since 2017, see the number of articles. The number of articles are still minuscule, but still it's very fast. It's helping in phenotyping and endotyping. So we can phenotype better with the AI because it has got a bigger data. So whatever observation we are seeing, say I would have seen maybe close to 1,30,000 patients by now, but the AI would have seen 1 million patients. Obviously, it will be 10 times better than me in picking up the, diagnosis. Pathophysiology, endotype, AI would be able to understand things much better because it's the collective experience of all of us sitting there, here, or on the globe. The anatomy and pathology, obviously radiological is the first one because that's the easiest, and we are seeing already that anatomy and pathology being picked up on the radiology, on the CT scan, on the X-ray. This is the first one. Endoscopies will be next. These are the first ones. Prognosis based on parameters. So right now by experience, why do people go to a doctor who is 55, 60-year-old? Because he has seen a lot of world, he has seen a lot of disease, and he would be able to prognosticate the patient better. Fine, I will do your surgery, but you still may not be 100% all right. This is what a 55, 60-year-old will say, which a 30-year-old will say, Arey, I'll do your surgery and you'll be absolutely fine, right? So prognostication based on the parameters will be better with the AI because it will have experience of 60,000 years or 6 lakh years, right? Because so many doctors will put their data into the AI and it will give you the prognosis based on the collective data of all the people, not of one person, how he has learned. And outcomes of FES, SNOT scores, what will be your score after doing the surgery? AI will tell you beforehand. If this is the CT scan, as standard surgery is done, this is how you're going to perform later on because this is what the data tells before. Surgical planning, obviously, navigation. So robots will work with navigation, which will work with the high-end CT scanners and MRIs. And day is not far when actually robots will do the surgery. We'll be sitting and having our coffee and just making sure that everything is all right, like the pilots are doing. Put the plane on autopilot and sip the coffee. Only in emergency you intervene, right? Days are not far. It may be 20 years, it may be 10 years, it may be 30 years. I really do not know, but this is what is going to happen. Now, Purdue University of US, this is an Indian guy, Dr. Snehasish Mukhopadhyay. He is an engineer and he's making an AI model, and he's got some success already to predict sinus surgery outcomes. And he's got a grant of a few $1 million for that. What will be the outcome of sinus surgery? Should you do it? Should you not do it? Now the insurance company will take this data and will pass only the the surgery where you are going to get the outcome positive. Otherwise, they will refuse it. And same thing will happen to our medical colleges. The HOD will not okay the list for the resident to perform the case, which will not give result. So this is going to happen. So these predictive AI models he helped develop could eliminate cases where there's no medical benefit of sinus surgery at all, relieving hefty financial burdens as well as significant physical and mental costs for millions of Americans, obviously. So this is what we have to understand, that this is how science is going to very fast, progress. Now, I cannot stop before putting one word to sleep. Obviously, I'm a sleep guy. So I am already using a technology. See, why sleep study is difficult? Because you have to put in all the wires and then you have to be in the lab, and it's difficult to sleep and there's a lot of cost attached. Now see this device. Oh, can you have sound? Okay, 1 sec. I'll put this. Can you just give the sound? All right. So this is an AI-based sleep study device. Pulse Ox was very easy. Now this also gives stages of sleep. Stages of sleep based on.
Has been known to cause more than just daytime drowsiness. The negative effects of sleep deprivation can take a serious toll on your physical and mental health. Long-term sleep deprivation can lead to weight gain, memory impairment, decreased job performance, and many chronic diseases, including heart failure, stroke, arrhythmia, hypertension, diabetes, and cognitive impairment. Do you often feel tired, have difficulty concentrating, or experiencing mood swings, even after a full night's sleep? Has your partner ever complained about your snoring, gasping, or wheezing at night? If you answered yes, you may be experiencing obstructive sleep apnea, one of the most common sleep disorders. Obstructive sleep apnea occurs when the soft tissues of the airway relax and collapse during sleep, blocking the airway and causing a drop in blood oxygen saturation. This causes the brain to signal a physical stimulation of the body to resume breathing, which results in a disruption of your sleep. The Belong Ring is an innovative technology that sheds light on your sleep health by monitoring your sleep patterns and pre-screening for obstructive sleep apnea, all in the comfort of your own bed. When worn during your normal sleep routine, the Belong Ring measures and records your body's biomarkers, including pulse rate, respiratory events, autonomic nervous system response, body motion, sleep stages, and blood oxygen saturation.
Now, this is important. This works only on the peripheral arterial tone, which is altered because of the disturbance in sleep and the oxygen saturation. So this gives sleep stages. This gives the autonomic nervous system response. This is AI. This is purely AI, and this will transform.
Sleep data is securely sent to the Belong cloud for now.
I'll just fast forward.
Your night in-lab poly to 90%.
So you do not need all this in the future.
In-lab sleep tests. The Belong Sleep platform provides a total sleep solution.
I'll not
clearly shows that I'm not.
So this is how the whole thing is going to be transformed, and obviously the sinus and the septal deviation is there in half of the population. Is suffering from septal deviation. Allergy is there in 25% of the population. Long soft palate is there in almost all males, half of the population. So we are sitting on, a ticking time bomb, and we are already becoming obese because we are eating more Indians also now. So AI will help definitely in diagnosis and to some extent the surgical treatment as well in the future. And I believe time has come that we all should understand the